Hi dear, today we are going to talk about sinus infection. If you've ever had a cold that just wouldn't go away, chances are it was sinusitis, an inflammation of the paranasal sinuses, the cavities within the bones that surround the nose. The sinuses are lined with a thin membrane that produces mucus, which is normally swept along by hair cells and drains through small openings into the nasal cavity. Sinusitis, also called rhinosinusitis, starts when this drainage system becomes blocked, usually from swelling due to inflammation caused by infection or allergy. Soon, your head hurts, you feel facial pressure or pain, and thick mucus clogs your nose. The symptoms may clear on their own, but often they persist or repeatedly return. What are the sinuses? The sinuses are small, empty spaces behind your cheekbones and forehead that connect to the inside of the nose. Sinusitis causes the lining of the sinuses to swell up. This stops mucus draining into your nose and throat properly, making you feel blocked up. Anatomy of the paranasal sinuses. The paranasal sinuses comprise 4 pairs of sinuses that surround the nose and drain into the nasal cavity by way of narrow channels called ostia, singular, ostium. Mucus leaving the frontal, forehead, and maxillary, cheek, sinuses drains through the ethmoid sinuses, behind the bridge of the nose, so a backup in the ethmoids is likely to clog the other 2 types of sinuses. The sphenoid sinuses are located deep in the skull, behind the eyes. Sinusitis develops when 1 or more sinuses become blocked. There are millions of bacteria in our noses, and most of the time, they're harmless. Even when a few creeps into the sinuses, they don't cause trouble, as long as they keep draining into the nose along with mucus. But if sinus drainage is blocked, glands in the sinuses continue to produce mucus, and the resulting pool of backed-up mucus provides what calls the perfect culture medium. The bacteria grow out of control, causing infection, and the immune system kicks off an inflammatory response. The result, swelling, which causes headache and facial pain, mucus buildup, which produces congestion, and an influx of white blood cells to fight the bacteria, which thickens the mucus and may tint it yellow or green. Other symptoms include loss of smell or taste, cough, bad breath, fever, toothache, and fullness in the ears. Sinus blockage can have a variety of environmental, anatomical, and genetic causes, but the main culprit is swelling of the nasal passages produced by the common cold or allergies. More serious sinusitis can result from structural problems, such as a deviated septum, a crook in the partition that separates the right from left nasal cavities, or nasal polyps, small, rape-like growths in the lining of the sinus cavity. Defense against sinusitis, nasal irrigation. One of the simplest, cheapest, and most effective ways to prevent and treat sinus problems is nasal irrigation. Using a homemade solution, you can often relieve sinusitis symptoms, reduce reliance on nasal sprays and antibiotics, and improve your quality of life. At least once a day, follow these steps. Stir ½ teaspoon of non-iodized salt and ½ teaspoon of baking soda into 2 cups of lukewarm distilled or previously boiled water. Fill a small bulb syringe with the salt water solution. If you prefer, you can use a small pitcher called a neti pot to stream the solution through your nose. Lean over your bathroom or kitchen sink, insert the tip of the syringe just inside one nostril, and gently squeeze the bulb. The water will run back out the nostril, or possibly the opposite nostril, and into the sink. Use at least 1 full bulb of solution. Repeat the procedure in the other nostril. If the salt solution stings your nose, use less salt. Thoroughly rinse, with distilled or cooled boiled water, and dry the bulb syringe or neti pot after each use. Sinus infection symptom. If you do come down with a sinus infection, you will likely experience multiple symptoms, such as 1. Nasal congestion and green to yellow nasal discharge. 2. Sinus pain, pressure, or fullness in the face, including the ears and teeth. 3. Headache and fever. 4. Postnasal drips. 5. Cough and sore throat. 6. Fatigue. 7. Bad breaths. Treatment. Your doctor will determine if you have a sinus infection by asking about symptoms and examining you. Antibiotics are not needed for many sinus infections. Most sinus infections usually get better on their own without antibiotics. When antibiotics aren't needed, they won't help you, and their side effects could still cause harm. Side effects can range from mild reactions, like a rash, to more serious health problems. These problems can include severe allergic reactions, antibiotic-resistant infections, and C. diff infections. C. diff causes diarrhea that can lead to severe colon damage and death. However, in some cases, you may need antibiotics. Talk to your doctor about the best treatment for your illness. For some sinus infections, your doctor might recommend watchful waiting or delayed antibiotic prescribing. Watchful waiting: your doctor may suggest watching and waiting for 2 to 3 days to see if you need antibiotics. This gives the immune system time to fight off the infection. If your symptoms don't improve, the doctor may prescribe an antibiotic. Delayed prescribing: your doctor may prescribe an antibiotic but suggest that you wait 2 to 3 days before filling the prescription. You may recover on your own, and may not need the antibiotic. Thanks for watching. Hope this video was educative to you. See you in our next video. Please make sure you like, share, comment and subscribe.